Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, your board certified rheumatologist and obesity medicine specialist. As a rheumatologist, I see many patients who have gout, and one of the biggest questions they ask me is what alcohol has to do with gout. Well, today's video is about beer and ciders, the hidden gout risk, and how a study recently showed that alcohol's role in gout and what type of alcohol plays a big role. And as a rheumatologist, I would like to continue sharing my insights about many autoimmune diseases, inflammation, and obesity. And in this video today, we will be talking about a new article published in JAMA. JAMA is a medical journal where they take important recent studies that can be helpful for different topics. And I chose this for you to understand what is the relationship between gout and different type of alcohols. This study is an interesting one. It examines the relationship between different types of alcohol and the risk of developing gout. If you ever wondered how alcohol might affect your gout risk, especially drinking beer or ciders, this video is for you. Let's dive into the study. Overview of gout and alcohol's role is going to be something that would be helpful for you to understand. So gout is a type of an inflammatory arthritis. It is caused by the buildup of uric acid in the blood, leading to painful crystal deposits into the joints. It is common knowledge that certain lifestyle factors, including diet and alcohol consumption, can increase the uric acid levels. But how much does alcohol really affect gout risk, and some drinks worse than others? So what is the type of the alcohol that is worse? That's what we want to know. Then this new study takes a closer look at the type of the alcohol and how each one of impacts the risk of developing gout. So the study conducted by authors, Dr. Lyu, I feel that their pronunciation may be incorrect, but I'll say Liu, and colleagues used the data from UK Biobank, analyzing 400,000 participants, about 180,000 men and about 220,000 women. They wanted to see how different type of alcohol correlated with the onset of gout while addressing limitations of earlier studies like gender bias and reverse causation. Participants reported their weekly consumption of various types of alcohol, including beer, cider, red wine, white wine, champagne, and spirits or hard liquor. The researchers adjusted for multiple variables and found some intriguing results. The key findings of the study were that beer and ciders carried the higher risk of gout in both men and women. The study found that consuming just 1 pint of beer or cider per day increases the risk of gout by 60% in men and 62% in women. Men in particular were more likely to consume higher amounts of beer and cider. Interestingly, red wine and spirits were less associated with gout risk. Among women, red wine actually had a neutral effect with hazard ratio of 0.92, while the spirits were the least associated with gout in men, hazard ratio of 1.12. The study also found that men who were current drinkers had a higher risk of developing gout than men who abstained from drinking. But for women, this difference wasn't significant. So what I'm trying to say here is that it is obviously going to be less risky if you're not drinking alcohol, or you do it occasionally. But if you are a regular drinker, you need to abstain from beer and cider, even if you're a man or a woman, because the risk was higher in both of them. So why does alcohol, and specifically beer and cider, raise the risk of gout more than other types of alcohols? Well, the answer lies in how alcohol increases serum uric acid levels, leading to hyperuricemia, which is responsible for gout attack. Beer and cider contain higher purines levels, which directly translate into having an elevated uric acid. This study also suggests that the difference between men and women in how they consume alcohol may explain why men have higher overall risk than women beyond their biological differences. It's the matter of the quantity. Quantity matters. It's not between male or female as much as how much drinking are you doing. And we know that they're drinking more than one drink a day for women and more than two drinks for men is considered above the threshold for many diseases, including cardiovascular diseases and metabolic syndromes. So we now know that alcohol containing high purines increases the uric acid level, which leads to gout attacks. So what are the ways we can manage alcohol and gout-related problems? Well, it means that we need to either cut back on drinking or reducing the drinking. But as a rheumatologist, I would say limit beer and ciders since these drinks are associated with the highest risk of gout attack. Try to cut back on them if you are prone to gout. Consider red wine. If you do drink red wine, it appears to have least impact on gout risk, especially in women. Moderation is the key. Total alcohol consumption matters. Higher intake means higher risk, especially for men. And focus on overall health. Reducing alcohol intake is just one of the part of managing your gout. Food also comes into play. Now, high fructose and high purine foods like seafoods, that's another video to talk about, but that has also been associated with it. So focus on balanced diet, stay hydrated, dehydration can also trigger it, and maintaining healthy body weight. To wrap things up, I would like to say that this study reaffirms alcohol, especially beer and cider, plays a significant role in increasing gout risk. Men in particular should be mindful of their total alcohol intake. However, it is not just eliminating alcohol, it is about managing your entire lifestyle to keep uric acid levels low and prevent painful gout flares. If you have any questions about managing gout, please drop them in the comments below. And remember, gout is treatable. Consistency with your lifestyle changes and treatment plan can go a long way. Finally, if you found this video helpful, please do not forget to like, share, and subscribe to the channel for more tips on managing chronic autoimmune diseases, inflammation-related diseases, obesity-related problems, and how to live a youthful life full of vitality. And hit the notification bell so that when I publish a new video, you get notification. Thank you for watching and take care of your health, and I will see you in the next video.